Thank you for listening to Depictions Media Radio. Welcome to Policy and Rights, the show about human rights and government policy. And welcome back, everyone. Okay, so up next we have a message from the Pan American Health Organization, or PAHO, Dr. Etienne. She is going to, of course, go through some of the statistics that's happening here in the Americas, where we have over 17 million cases of COVID being diagnosed, and we have over 500,000 deaths due to COVID-19. The number of cases and number of deaths are more than half of the global cases and deaths recorded, and it is becoming an issue where Brazil and, of course, the United States are some of the biggest drivers in a number of cases. As we know, the White House recently reported that Donald Trump, the president, has tested positive, as well as several aides have tested positive for COVID-19. So let's listen to what Dr. Etienne has to say about what the overall outlook for the Americas with COVID-19 is.
Thank you, Sebastian. A very good morning to you, and let me thank you again for joining this week's briefing. As of 6 October 2020, there have been over 17 million cases and more than 574,000 deaths due to COVID-19 in the Americas. We remain home to half of all COVID cases and more than half of all deaths globally. Last week, PAHO hosted ministers of health and other delegates across our region for the 58th Directing Council to discuss the critical health challenges facing our region. And yes, COVID took center stage. During this two-day virtual meeting, ministers shared lessons from their COVID response and committed to working in solidarity to overcome this virus. Every country in the Americas has been challenged by COVID, and our member states must work together to overcome it. There is no other way. While Brazil and the US remain significant drivers of new cases in our region, we are concerned by spikes in cases, including in places that had effectively managed outbreaks, like Cuba and Jamaica. In fact, over the past 60 days, 11 countries and territories in the Caribbean have moved from moderate to intense transmission, which is a concerning development as countries reopen airspace. Transmission remains very active. Some countries in our region are suffering recurrent spikes in cases. The virus is also spreading in new and different ways. Today, I'd like to share a few observations to give you a sense of how this virus is continuing to spread throughout the Americas. Recent data show that in some countries, COVID-19 is exacting a larger toll on young people, more than we saw earlier in the pandemic. More than 500,000 children and adolescents in our region have been infected, and these numbers continue to rise. When we look back at the data over the last few months, we see that in the US, Young people, especially those aged between 20 to 29 years, they had the highest incidence of infections of any age group. In fact, they represent more than 20% of new COVID 19 cases. Many of them are unaware that they're infected because they have mild or no symptoms. While many young people won't become ill or require an ICU bed, they are not immune to developing the serious effects of COVID 19. We also worry that as more of us venture outside, that cases will spread to other more vulnerable groups. This is particularly concerning for the elderly and those with pre-existing conditions like diabetes or hypertension, for whom a COVID diagnosis can be much more serious. So let me urge people of all ages to continue to wear masks, practice social distancing to protect themselves, and avoid exposing others. The good news is that rates of severe COVID illness have fallen across our region. Today, fewer people are being hospitalized and fewer require intensive care than before. This is due in part to our growing knowledge of this virus and how to manage critically ill patients. It is also credit to the work of governments across our region that acted quickly to expand laboratory networks, increase hospital beds, and hire and train healthcare workers. PAHO has been working with countries as they strengthen their health systems to meet the needs of this new pandemic. Over the last few months, we've held more than 160 training programs. We've delivered more than 17 million COVID PCR tests and millions more gloves, gowns, and masks to keep health workers safe. When hospitals are able to cope and manage patients, there are fewer deaths. These efforts have helped save thousands of lives and will continue to protect countless more. So, once again, I wish to thank all healthcare workers everywhere for their dedication and commitment, especially as many of them have had to work under difficult conditions. Yet, despite these efforts, too many people remain at risk, especially those with limited access to prevention and care. Time and again, we have seen how health emergencies expose and exacerbate inequalities across gender, income levels, and race. And indeed, we have new COVID data that puts these trends into sharper focus. Within the United States, which is home to more than 40% of new cases in our region, Black, Hispanic, and Native American populations are nearly 3 times as likely to contract COVID as their white counterparts. They are also nearly 5 times as likely to be hospitalized and twice as likely to die from the virus. In the Amazonian areas of Colombia and Brazil, indigenous people are 10 times more likely to contract COVID 19 than any other groups. We are also worried about migrant and refugee populations who may be increasingly exposed and at higher risk as they search for better opportunities during these challenging times. And that is why PAHO has been collecting information about COVID's effects on refugees and migrants to help countries adjust their responses. Early on, PAHO issued specific recommendations to care for these vulnerable groups in the age of COVID. And we've acted on them. We have provided support to national authorities in Ecuador, Costa Rica, Brazil, and Mexico to design strategies so migrant populations can continue to have access to the food, the healthcare, and mental health support that they need. Migration is part of our history in the Americas. We've always witnessed people moving across the continent in search of a better life. Yet, migrants remain especially vulnerable to this pandemic because they're often at the margins of our health system with limited access to care and social protection that may be available to others around them. Later this week, PAHO is signing a landmark agreement with the UN's International Organization for Migration, in which we commit to work together for the health and well being of our migrant populations. Our solidarity towards migrants is not only key for controlling transmissions and preventing unnecessary deaths due to COVID 19, but it is a core reflection of our shared belief that everyone has a right to health and that we must leave no one behind. Thank you. Over.
Muchas gracias, doctora Etienne. Comenzaremos
Thank you
ahora.
very much, Dr. Etienne. And with that, we're going to move on to the Q&A session. We're going to begin with the questions that we received via email, and then we're going to move on to live questions and questions received via the chat. Please use the Q&A button and remember to include your name and media outlet. The first question is from Kumar Malhotra at BBC. Y dice,
have now passed the peak of infections as measured by daily new cases. Doctora Etienne?
Thank you for this question. It is true that while transmission remains high in some countries in the Americas, others appear to have passed the worst of this current wave of COVID 19. However, as we have seen in other parts of the world, reductions in peak transmission does not mean that we are out of the woods. Far from it. So long as we lack effective specific therapeutics or a vaccine that has been tested, approved, and widely rolled out, we remain vulnerable to COVID 19. And all the time that we are vulnerable, the only things keeping the virus at bay are the recommended public health measures, such as hand washing, cough etiquette, physical distancing, and the use of face masks. Once we begin to lift these measures while the virus is still in circulation, we will see new increases. The region of the Americas is a complex mosaic of age groups, cultures, ecosystems, and health systems that are better prepared to deal with the pandemic than others. And this is why it is vital that countries demonstrate leadership, particularly at the local level, to ensure that public health measures are implemented in the specific areas where they are needed the most, and that economic and social protection measures are also put in place so that people do not have to decide between their lives and their livelihoods. And as I mentioned before, we do understand the fatigue that people are beginning to feel regarding some of the public health measures. But the public does have such an important role to play in stopping transmission. And at the moment, these are the best tools that we have available to protect ourselves and our loved ones.
Thank you, Dr. Etienne. La siguiente pregunta vino
the next question comes from Julia Salis-Kov from Reuters. And it says,
the opening too early. Dr. Barbosa?
Thank you for the question. You know that we cannot talk about a similar situation in every country in Latin America, in the Caribbean, or in North America. We have a very different situations, as was highlighted by our director in her inaugural words. We have countries that are controlling the transmission, we have seen in the last weeks some countries, many countries that are reducing the transmission, but they have still a very high level of transmission, so they cannot believe that the battle has already been won. They need to continue all the measures that they have already implemented. So to a safe reopening of the economy, it's very important to know the epidemiological situation, not only at the national level, but in every state, in every province, in every municipality. So the national authorities can make the best decision. What to open, what are the protocols that they need to implement in order to avoid another outbreaks, and to monitor the situation very carefully, because if they detect that the transmission is increasing again, they can go back and to adopt new measures to control the transmission. So it's very important to strengthen the information that will be the best basis for the decisions about what and when reopen. Thank you.
Gracias, doctor. La próxima pregunta.
Thank you, doctor. The next question is from Daniel Kinsler from Bloomberg, and it says,
Is doing a good job tracing cases in Latin America, Dr. Alighieri?
Thanks a lot for this question. The contact tracing is not a standalone measures. It goes with strong surveillance, strong laboratory network. It is the continuum of early detection of cases and quarantine of contacts. Countries with strong existing public primary health care networks are better prepared for contact tracing. Also, pre-existing field epidemiology training programs with junior and senior epidemiologists is a plus. Contact tracing has been also largely used in the Americas for some diseases as measles. So there is an experience of using contact tracing, mainly related to the eliminations of measles. Contact tracing is much more efficient with good tools, recent tools as GoData. It's a software that is very helpful in visualizing and organizing the information. And GoData is operational since the beginning of the regional response to COVID, operational in more than 20 countries in this region. Yes, there are good examples of efficient use of contact tracing, mainly in the Caribbean, but also in other countries. The Bahamas has a task force for contact tracing. Jamaica has been very successful. Suriname has been successful, and also Cuba in the context of a primary health care. Excellent pilot experience in Guatemala that is going to be expanded to other departments of the country. And as part of a battery of interventions for larger countries with large superficie as Brazil, Colombia, Chile, Argentina, dealing with remote populations, but also complex settings as large suburbs. So this is the panorama of the contact tracing in the region of the Americas. Thank you.
Muchas gracias, doctor. La siguiente pregunta vino de Michael Clocks from Depictions Media in British Columbia, Canada. Dice, how do you determine when a wave of infections ends and a new wave begins? How important is it to determine waves for health officials? Dr. Espinal?
Thank you very much, Michael, for this very important question. Now more important that we are entering in the fall and winter is coming, there is not a mathematical exact prediction when determine a new wave, but there are signs that we can and indicators that we can look at. And first of all, historically, when we look at history, H1N1 in 2009 and also the flu pandemic in 1918, they all started with a wave in the spring. and then a second wave in the fall. So, and today we're seeing a second wave in Europe. Several countries are experiencing a second wave. It is important to differentiate between the peak of a wave and the wave itself. The best system to detect a second wave, it's a combination of indicators. First, have a strong surveillance system and a mechanism to test, trace, and isolate. The surveillance system is vital. Why? Because not only national, but more importantly at the administrative levels, cities, provinces, counties, and so on, because that will allow us, if we offer the testing to the population widely, that will allow the national authorities to detect incipient outbreaks. So that will come after, if the curve has been flattened. So test, trace, and isolation. The other issue is to keep the positivity rate ideally below 5%, and the curve. If we're looking at the curve and it's flattening after the peak, then and if we have a sustained positivity rate of the testing in the last few weeks, we can say that a good control system is in place, and probably that wave is being controlled. But certainly to avoid a second wave would be to have a strong system of detection, isolation, identification of contacts to ensure we prevent those. And finally, not only when to say the second wave, but also what to do. And the best way to avoid the second wave is to continue doing the non-pharmaceutical measures. We recognize there is fatigue, but basic hygiene, avoiding crowded places, and social distance are key issues to avoid a second wave, which inevitably is happening. And not until we have a vaccine could we potentially rule out second wave for not even 100%, but with some degree of certainty when the vaccine is rolled out and so on, provided they are efficacious. Over. Thank you.
Gracias, doctor. Tenemos dos preguntas.
Thank you, doctor. We have two questions that have to do with Venezuela and the Russian vaccine from Shampur, Blankberg, and Laureana de Barros. Nicole is asking, Venezuela.
Around 3,000 units of the Russian COVID-19 vaccine, currently in phase 3 of trials to be tested in Venezuela. Is PAHO aware of this trial and its details? Is it overseeing its applications in any way? Y Mariana de Barros de TV Venezuela también pregunta, dice que la vacuna
And
rusa.
Laureana Barros says that the Russian vaccine is in Venezuela, that it went through the qualification stage. And the question is, has it also passed the WHO pre-qualification testing? And also, what would you say about Venezuela being the first country that would test this phase of the vaccine? Thank you very much, Sebastian. I will answer the first question in English.
Was not aware or consulted regarding the planned trial of this vaccine, of the Russian COVID-19 vaccine. Hence, PAHO is not involved into the application of the trial. So currently, we know of this trial from the news. So we are in that level. Respecto a la pregunta de la precalificación, quisiera...
Now, regarding pre-qualification, I would like to say that there is no pre-qualified vaccine at this point. WHO is collecting scientific information from all the regulatory authorities in countries where the different phases, the different clinical test phases are occurring, and Russia communicated data from phases 1 and 2. The countries that are negotiating or that have been in contact with the pharmaceutical firm that is producing the vaccine have bilateral agreements, in some cases with the involvement of other players, to do this testing, and some countries are involved in several trials at the same time. Thank you, Doctor. I now want to call on Gisela Salomon from AP for her to ask her question. So, Gisela, if you can hear us, you have the floor. Thank you. I wanted to focus my question on Argentina. Argentina has become one country of the world with the highest contagion, even surpassing Mexico in recent days. And the cases have spiked, and they're also in the hinterland of the country, even though Argentina had a very strict quarantine. Why have the cases increased in this way? Why is the positivity rate so high? Where was the failure? What could they do? Is there something that the government or that epidemiological authorities did not take into account, something they did not foresee? Was there some failure in logistics or planning? Thank you, Gisela. And here I also want to say that we have a question from Joao Paulo Chanuk from Nesha Jornal. So, Director Spinal, could you please respond to this question? Yes, thank you, Gisela. Thank you for your question. And I also thank your colleague for his question. Argentina did take good measures. It was one of the first countries, as you first said, to implement measures, to put a quarantine in place. And it took measures to protect its population. There was a meeting with all governors. Also, they worked with civil societies, specialized agencies to receive their input. And we should congratulate the Minister of Health for this action. However, it is important to take into account that, as we have said several times, this is a virus that is unpredictable. We have not lived with it for a whole calendar year. We're learning every day more and more about it. And Argentina quickly increased its number of beds in hospitals and in intensive care units. It began its educational campaigns too, well in advance. Perhaps the hardest thing for Argentina was the contact tracing. That is harder to do, especially in Greater Buenos Aires. And perhaps that could be improved upon. But definitely, it's not a matter of drawing comparisons or saying, yes, they did everything right or everything wrong. Argentina is doing everything that it can. We have absolutely no doubt that the time will come when the curve is flattened if the measures recommended continue to be applied. And the government of Argentina is working with our office in Buenos Aires and also with headquarters here in Washington. And we have no doubt that that time will come. But what perhaps could have been better would have been the tracing system, following up on contacts of positive cases so as to isolate them more quickly. But Argentina has definitely taken very good measures, and the virus discontinues its natural history, its natural course. And with no doubt, at some point, this curve will begin to flatten. Thank you. Thank you, Doctor. Now I would like to give the floor to Isabela González from Diario La Reforma in Mexico. Isabela? Good morning. I would like to say that yesterday, or day before yesterday, Mexico announced a new methodology for counting cases and deaths caused by COVID-19. The new methodology counts deaths and contagion with association. In other words, no need for testing. It's a matter of having had the symptoms and being in contact with someone that was positive to COVID-19. So my question is, would it be important for the population to know of this right from the start? Thank you, Isabela. Dr. Barbosa, would you please field that question? Yes, thank you. Thank you, Isabela, for your question. Mexico is testing a new methodology that is more sensitive to detect cases. That's a strategy that's used for a lot of diseases, not only cases confirmed by lab tests, but when the contagion is very intense, when access to lab testing is limited, it is possible to use this strategy where cases are confirmed by what we call clinical characteristics. In other words, a person that has a clinical picture that is in keeping with COVID-19 or some other disease, and also by epidemiological association. In other words, a person who was in contact with a proven case. And I think that this will give Mexico more accurate information regarding the number of cases, the number of deaths. So it is important to be able to expand knowledge of the situation. Also, PAHO has been working with Mexican authorities to expand the testing capability. Testing capacity is tremendously important. It allows you to see the trend, to know what is happening in the country, what the number of cases is like, the number of deaths. So for statistics, but also to monitor trends and also to point to specific measures. For example, if a person has a positive test, you can recommend isolation measures, you can monitor that person's contacts. So both things are important. And that is what Mexico is doing so as to make its system more sensitive to better detect cases and also to expand its testing capability at the same time. Thank you, Doctor. Now I would like to give the floor to Lidia Lopez, who is with La Prensa in Nicaragua. Lidia, the floor is yours.
Lidia, no sé si nos estás escuchando para hacer tu pregunta. Ok, si no, yo puedo leer la pregunta que nos mandó Lidia. La pregunta de Lidia dice...
Lidia's question says, there is a trend in Nicaragua, and this means that the population is learning to live with the virus. In other words, people are showing that they have learned to protect themselves or they have taken on new protective habits, because she says that there are greater public activities in Nicaragua and physicians are saying that there may be a new outbreak. But according to the health authorities, the trend is downward. How should we interpret that? Has the danger passed? Or are the incubation periods longer? Or does this have to do with people being asymptomatic? Dr. Duarte, thank you, Sebastian, and thank you for reading that question from Nicaragua. Let me answer along what Dr. Etienne said in her opening remarks. We are in a period where COVID-19 is being transmitted, and it's going to be with us for many more months. We have to take precautions at every turn. And those precautions have to be taken even more precisely at a time when apparently there isn't much transmission. We have seen the experience in many countries and many areas where after a lot of effort on the part of people in the health sector and other sectors, they've been able to lower the trend, bring down transmission, and as Dr. Espinal Dr. Alighieri, Dr. Barbosa was saying, they have been able to flatten that curve. So everyone feels optimistic, thinking that we have left the risk behind. But the truth is, when we feel that we're on the other side of the problem, that is when the transmission actually picks up. So when there's a report that transmission is being brought down, we have to be cautious and we have to continue to assess the situation. We may feel fatigue, but it would be worse to have a second wave affecting the population and also affecting the economy and the social situation. We have seen that when outbreaks occur after a very short period of time, that causes more deaths because healthcare services are overloaded. So in Nicaragua and other countries where they're saying, okay, we are hearing that there are fewer cases, that means that you still need to implement hand washing, physical or social distancing, and wearing face covers. And when the symptoms do appear, you need to find medical care and also inform people with whom you were in contact for them to take the necessary precautions. So it's everybody's responsibility, and we hope that in that way we will be able to lessen the impact of COVID-19. Now we're hearing from Erika Cabal Martinez from He Radio International. She says, how is research doing? What are the clinical trials saying about treatments without vaccine for SARS-B2? Thank you. Thank you for that question on research. Right now, the most important thing to highlight is that we have to comply with care standards and also the therapeutic protocols of dexamethasone, for example, other tested medications. Dexamethasone has been shown to lower mortality in patients with low oxygen levels. There are a lot of studies underway. I would like to mention one, and it is the Solidarity Trial. It is the most important project being coordinated by the World Health Organization worldwide, testing new therapeutics. In the Americas, countries like Argentina, Brazil, Colombia, Honduras, Peru, and others have already mobilized patients to take part in the different arms of the Solidarity study. Now, worldwide, more than 12,000 patients in 30 countries are participating in the trial, and thanks to that, it has been possible to update clinical guidance. The active arms of this Solidarity trial, some were eliminated. For example, hydroxychloroquine was removed from the trial. Compare the care standard alone with the care standard adding one more intervention or one more medication. And right now, the Solidarity trial includes medication like remdesivir, well known to you. We have mentioned it several times in this forum. Also, acalabrutinib and interferon beta 1A. We are making strides every day. We're learning more and more about this disease, and data is being processed thanks to the support of this worldwide network that I just described. Thank you. Thank you, Doctor. We have several questions having to do with schools. The first comes from Juan Manuel Nieves from Xinhua in China, and it says that in Argentina, people haven't gone to school since last March, and there is no clarity in terms of when they can go back to face-to-face learning. What is the impact on students? And according to PAHO, what are the conditions that provide for a safe return to face-to-face classes? And how can we imagine what the new normal would be like? And also, we have from Alia Bings from CBC Barbados a question about education. But she says, in the case of Barbados, does PAHO think that the government, and I should say this in English,
Barbados recently recorded 2 cases of COVID-19 in one of its secondary schools. Although Barbados government has been commended for its ability to control the spread of the virus, do you think the government missed the mark by reopening schools? That's the question from Alia Briggs from CBC Barbados. Doctor Espinal, ¿usted podría tomar estas preguntas?
Dr. Espinal, could you answer these questions, please? Yes, of course. The first question I will answer in Spanish, and I will answer the second one in English. Argentina is still going through a very strong or deep epidemic crisis, so it has to take that into account. Now, in terms of schools, schools must shut down as the last resort. As early as March, the World Health Organization and PAHO have issued recommendations and tips regarding what to do at schools. And more recently, in September, together with UNICEF, we issued guidelines recommending school reopening or shutdown should be based on a risk-based analysis at the local level, that is to say at the community level, because the entire country does not need to shut down their schools unless there is intense community transmission. And there are several categories, and this is available on websites for government to consult. For example, intense community transmission means that schools continue to remain closed to prevent transmission, and if possible, have distance learning or virtual learning. But we acknowledge that virtual learning is not available in all of our communities. So it is important to do that risk assessment so that if it's possible to reopen some schools where there's no community transmission and there's no such risk, then schools can reopen with the specific recommendation, because there are specific recommendations such as, keep social distancing, try to expand the available spaces in the school, have increased ventilation, etc. In the case of Argentina, we are sure that the authorities will reassess the situation as soon as the curve starts flattening. But like I said, it will not necessarily be a blanket solutions to all especially in large countries.
I think Barbados missed the boat by 2 or 3 cases in schools. One of the recommendations, if there is only 1 or 2 cases or very low digit, in very low numbers, the schools can be maintained open, and because education is really critical for the children. As long as we implement the measures on social distance, non-pharmaceutical measures, education, parents' education, engagement with the teachers also, include also, for instance, the issue of COVID in the curriculum to educate the children. The schools can be maintained open, except if there is, and there are clear recommendations based on categories, as I mentioned in Spanish, based on cluster transmission, community transmission, or no transmission, and so on. The important thing is to watch and monitor how the epidemic evolves. But if there is no increased sustained transmission, there is no need to close schools. It should be the last resort. Thank you. Over.
Muchas gracias, doctor. La siguiente pregunta.
Thank you very much, doctor. Our next question comes from Ariel Alberto Jara Acosta, journalist for Channel 19 in Coronel Oviedo, Paraguay. The question is there an estimated time frame to consider the pandemic over, Dr. Barbosa? Unfortunately, the answer is no. We do not have a way of saying how many months from now will it be before the pandemic is under control. Let us remember is that pandemic means that there's global transmission of a new disease, which is our current situation. This is what's happening with COVID-19. Now, let us remember that this started in China, then it impacted some countries in Europe, such as Italy, France, and Spain, that were highly impacted early on. Then it moved to the US, then Latin America. More recently, India has very strong transmission, and South Africa. So the virus continues to move around the globe. And that is why it is so important to maintain these surveillance measures and response actions and all of the actions that the governments have implemented to monitor the situation. And when they see that transmission starts going up, implement the necessary measures to bring those numbers down, including social distancing. And this is also a call for communities, families, and individuals. We have some actions that are highly effective in reducing transmission. For example, the use of face masks, keeping social distancing, leaving the house only for essential activities, hand washing, etc. So there's a lot of actions that we can continue adopting at the individual, family, or community level to reduce transmission until we have complete control of this transmission at the global level. Thank you.
La siguiente pregunta es de
Thank you, Doctor. Our next question is from Jennifer Preda from Montserrat Reporter.
If you are listening, you can do your question. No, it's
Hi.
Hi. Yes, we can listen.
You can hear me, okay?
Yes.
My question is related to a comment that the director mentioned, Dr. Edlian mentioned earlier. She talked about the reality of migration. And we know that at this time, we're seeing the many migrants are coming home for holidays around Christmas time, and although lockdown measures have eased in many cities in North America and Europe, we're now seeing a rise in COVID-19 cases. Some airlines have resumed flights to Latin America and Caribbean destinations. My question, I have two questions. Would you encourage people in North America and Europe to proceed with holiday travel plans to visit relatives and friends back home in other parts of the region? And two, what is your advice to member states in the Caribbean which have traditionally engaged in end of year's national cultural festivities? Should they proceed with these plans?
Gracias, Jennifer. Doctor Ugarte, ¿podría tomar esta pregunta?
Okay, thank you, Sebastian. Thank you, Jennifer, for this very important question. I would like to emphasize that the risk of transmission is still high in several areas of the Americas, Europe, and other regions. A decision to travel should be taken based on each individual context and risk analysis. So people that live in areas with no high transmission, with low transmission, and without movement restrictions, and people that are not in isolation and quarantine and are healthy may plan their travel. But prospective travelers that live in areas where community-wide transmission and movement restrictions are in place should reconsider their travels to a later moment. Persons who are in isolation or quarantine or get sick at the moment of travel should cancel their travels. Under all circumstances, people that travel must adhere to hand hygiene, use of masks, and physical distancing while on journey, but also at the destination. This is extremely important. And also, they should monitor their health at their destination. Of course, if they develop any symptom or they get sick at their destination, must self-isolate and seek medical care immediately. That way, the persons who get sick during the travel on the journey or at their destination will contribute to reduce the transmission. And although these recommendations are applicable to everybody, people who travel and visit their relatives may enjoy visiting their relatives and also the festivities if they apply these recommendations. These recommendations have been also put forward in a document that PAHO just published a few days ago. And we've been in close contact with many countries, particularly in the Caribbean, regarding the reopening of non-essential international travel. So enhancing surveillance, enhancing contact tracing, enhancing the capacity of laboratories to test, and also on the clear information for the travelers and their own population is something that the countries are implementing and are enforcing. And I think when everybody takes this responsibility of taking the protective measures, we will be better along because we will be in this situation for several months to go. Thank you.
Muchas gracias, doctor. Ya estamos llegando al final casi de esta sesión.
Thank you very much, Doctor. And we're nearing the end of the session. So one final question for Dr. Etienne. It says, muchos lugares...
And there is growing fatigue about these measures. What advice does PAHO have for people in the region? Doctora Etienne.
So thank you for this question. As you heard from the other panelists, when the first outbreaks of COVID-19 were identified in our region, many countries were quick to react. Cities came to a standstill, schools and offices were closed, events canceled, planes grounded. And this was painful and unprecedented. But let us remember, it saved countless lives and bought us time to prepare our health systems. Since then, we have seen cases go up, and we have fought to bring them down in many areas of our region. And in this process, we've learned more about how this virus is transmitted and how to better prevent its spread. This includes new ways to minimize risk, from wearing masks and sanitizing public spaces to developing new ways to meet, to learn, and to work remotely. All of us have adapted, and there have been many innovations to enable us to better face this new reality, including both within our health systems, but also in our own personal lives. However, this is not the time to let our guard down. Transmission is still very high in our region, and too many of us are vulnerable. While the pandemic continues, we can at least rest assured that research is taking place, as you heard earlier. Research that will provide us with new leads on how to reduce transmission, to improve testing, improve treatment, and eventually to develop a vaccine. So let's remember, the current situation will not last forever. But in the meantime, while it is true that most of us are growing tired of the restrictions imposed as a result of this virus, and we understand, I am confident, however, in our ability to continue to be resilient and innovative, and on a personal level, to find new ways to live our lives while navigating the new normal. So stay put with the well known and proven public health measures. Thank you so much.
Muchas gracias, doctora Etienne. Muchas gracias a todos por participar.
Thank you, Dr. Etienne. I thank all of you participating in this session. We will be sending you the opening remarks of Dr. Etienne and also the recording. And also, please remember that on Friday at 11 a.m., we will be signing an agreement between PAHO and the International Organization for Migration. You will be receiving information on that event too. So thank you for taking part in today's session and enjoy the rest of your day.
Okay, so I've heard of a number of things that are helping drive COVID numbers here in North and South America. I do want to remind you, of course, as we're heading into Thanksgiving here in Canada this weekend, that we should make sure that we are keeping our gathering numbers down, and maybe we can be a little more inventive in actually gathering with extended family members. Maybe we can use Zoom or maybe FaceTime or something like that in order to gather with extended family members, so that we can all enjoy the holidays together safely and together. So thank you for joining us. You've been listening to Policy and Rights on Depictions Media, and my name is Michael. So I do invite you to find and click on that subscribe button so you can keep getting continued updates from us as things develop. So have a good day, and we'll talk to you later. This show has been produced by Depictions Media. Please contact us at depictions.media for more information.